Class, good afternoon. I am your instructor for today. I'm teacher John Lee Atain. And in today's discussion, we will be talking about blood pressure. And I'm going to demonstrate blood pressure monitoring. Okay? Now, the very objective of this discussion, class, is that at the end of the session, you will be able to know and understand the basic concepts about blood pressure, the circulatory system, and the functions of your heart, as well as you will be able to identify the devices that we are going to use in monitoring the blood pressure of our patients. Okay? So, in this class also, we will also demonstrate to you how are you going to obtain properly the blood pressure of a patient. Okay? So let us proceed. Now, any one of you who have any idea about what blood pressure is? Yes? Anyone? Thank you very much. Okay, now, let us proceed. Now, blood pressure refers to the pressure that is being exerted by your blood against the wall of your arteries. So that is your blood pressure. Now, in determining the blood pressure, it is very important that we are going to understand the basic concepts about your circulatory system, because your circulatory system is also responsible for the regulation of your blood pressure. So in this illustration, you can see there a person with a red blood vessels and blue blood vessels, no? So your red blood vessels refers to your arteries, and the function of your arteries is to carry oxygenated blood towards the circulatory system, and your blue blood vessel referred to as your veins carries blood towards your heart. Now the blood that it carries is unoxygenated blood. Okay, so a connection between your arteries and your veins, no, because there is connection between the arterioles, the smallest portion of your arteries, and venules, which is the smallest portion of your veins. No, we call it your capillaries. Now, that is the basic concept about your circulatory system. Now let us proceed with your heart. Now your heart is the organ that is primarily responsible for the distribution of blood towards your circulatory system, or towards your systemic circulation, or towards your body. Okay, that is the function of your heart. So your heart also can influence the blood pressure differences or blood pressure readings, or the changes in blood pressure in our patients. So that is basic concept about your heart. Okay. Now, in this table, we are showing you a normal BP, a BP that is elevated, a BP that is stage 1 hypertension, and a BP that is considered to be stage 2 hypertension, and the patient who might experience or suffer from hypertensive crisis, which of course requires consultation among healthcare professionals or doctor for immediate management. Now, a normal BP is a BP that is between 120 over 80 millimeters of mercury, and an elevated BP is a BP that is having a systolic BP of 120 to 129 and diastolic BP of less than 80. Okay? And a BP that is stage 1 hypertension is a BP of 130 to 139 systolic BP, and the diastolic BP is 80 to 89. And the stage 2 hypertension is the BP your patient might manifest a BP of 140 or higher with a diastolic BP of 90 or higher. And a patient with hypertensive crisis, and as we have mentioned earlier, it requires consultation or attention of the healthcare professional, because your patient might have a cardiac attack. Okay, so the BP is greater than 180 systolic BP, and the diastolic BP is greater than or higher than 120. Take note of those values. So as we go along with our discussion, you can raise your hands and you can ask questions. Class, okay, do you have any question as of this time, as of this moment? None? Okay, that's very good. I hope you are following our discussion. So after this discussion, I'm going to demonstrate to you the proper techniques of obtaining a BP. Okay? Okay. So the next is the device that we use. Now, aside from the stethoscope, which is we use it in auscultating the BP of our patient, we are also using our sphygmomanometer. So that is here in our illustration, that is sphygmomanometer, the device that we use in obtaining the BP of our patient. And I'm going to show to you in a little while how are you going to use your stethoscope and your sphygmomanometer in monitoring the BP of the patient. Okay? And you can ask questions as we go along with our discussion and demonstration later. Okay, let us proceed with our discussion, and I am now going to demonstrate to you how are you going to obtain the blood. Today we are going to perform a procedure which is monitoring the blood pressure of my patient. Now before I'm going to start the procedure, I am going to sanitize my hand first. Hi patient, I am Dr. Akain. Today I am going to monitor your BP, and this procedure will not take too long, and this is also not a painful procedure. So patient, please state your name.
I am Kadikit Asadaran. I am 22 years old.
Okay, in this case, I am going to monitor the patient's BP. Our patient is a female and 22 years old. Now, going to our procedure, I am going to use an appropriate cuff, which is an adult cuff, in monitoring the BP of your patient. Now, this is the sphygmomanometer. So, before placing the sphygmomanometer on my patient's arm, I am going to locate for the antecubital space of my patient. And this is also the area where I can palpate the brachial pulse. Okay, after locating the brachial artery of a patient or the antecubital space, I am going to place the cuff on the arm of my patient. Make sure that the cuff is properly fitted over the arm of your patient. Make sure that it's not too loose and not too tight. If your cuff is too loose or too tight, you might be able to get abnormal BP readings. Now at first, I am going to check for the approximate systolic BP of my patient. So in checking for the approximate systolic BP of my patient, I am going to palpate for the radial pulse. So I am going to palpate the radial pulse of my patient. So after palpating the radial pulse, inflate the BP cuff with an increment of 10 to 15 millimeters of mercury. And take note when the pulsations will disappear. When the pulsations will disappear, that is the time that you can document that that is the approximate systolic BP of your patient. So in this case, the approximate systolic BP of my patient is 90 millimeters of mercury. So I'm going to take note that reading. Now I am going to determine the BP of my patient using the auscultatory method. Now using the stethoscope, I am going to place the stethoscope over the brachial artery or at the level of the antecubital fossa or space. Earlier, I have identified the approximate systolic BP of my patient at the level of 90 millimeters of mercury. Now, using the auscultatory method, I am going to add 20 to 30 millimeters of mercury to completely obstruct the artery of my patient. So after the procedure, I was able to determine that the BP of my patient is 90/60. That is 90 the systolic pressure and the 60 the diastolic pressure. Now, I am going to discuss with my patient the findings of her BP, and I will arrange for her next visit. Thank you.